Hi, this is Dr. Robert Silich, and this is a presentation that I've put together, which is a compilation of a bunch of talks that I've given in the past. I am a plastic surgeon. I am a clinical assistant professor of plastic surgery at Cornell University Medical College in New York City. And this is a talk, as I mentioned, that I like to give to prospective patients. I found that over the years of doing this, that the more information patients have prior to seeing a plastic surgeon, or if you're at least even entertaining the thought about having something done or wondering when you should have something done, that the more information you have prior to getting to the doctor's office is the better. One of the first things I always start with is the idea that gravity always wins. And it sounds like kind of a glib statement or something that's a little tongue-in-cheek, but it's really true when you think about the simplicity of it. And that is that nothing that I do, no matter how great a procedure someone can get or the best technical operation I can do or the best result, it's only going to be temporally related. And it's only going to augment your life, and it's only going to help, and in most cases help. In some cases it won't do much, and very few cases it can actually hurt, and that's part of what this talk is basically about, is to weed those kind of candidates out. But the idea behind this really leads into the second quote, which is from the great book, The Little Prince, and that is basically that the important things in life, without sounding too philosophical or heavy-handed, are the things that you cannot see on the surface. And those are the things that your relationships with other people, and only the things that I can try and make better through surgery, or that I can try and give you the confidence to then make the important things in life that much more enriching and that much more favorable, because there's really no operation, there's no procedure that anyone can do that will be that drastic, that can change something in your life from bad to really spectacular. So one of the ideas in plastic surgery that I love, and which is really one of the reasons that I was attracted to plastic surgery in my medical education, is that unlike other fields of surgery and even in medicine, relying on the patient's input is so much more integral to success in plastic surgery than any other factor that comes into the matter. And what that basically means is that plastic surgery is recognizable to not only doctors, but to lay people and to people in the media and to your family and to your friends and everyone. And there's a huge stigma on plastic surgery, particularly bad plastic surgery. And therefore, it's almost irrelevant how good an operation I do and how technically excellent it may be if the end result is that somebody looks like they're overdone, or somebody looks like they've had bad plastic surgery, God forbid, or that they look overdone, or even that somebody can notice that they had anything done sometimes. And what that basically means is that patients have to communicate very early on with the doctor what their goals are, what they want to get out of it, and it's really the importance of the doctor to kind of separate the fact from fiction in what they're saying and can try and figure out what's the right operation. And therefore, I always give equal weight, 50-50, to the surgeon and the patient, because as long as you're on the same page, the results should be very successful. And I also think that nowadays the training is such in plastic surgery that almost anyone you see in a major city is going to be a very well-trained, excellent surgeon, provided you go through several credentialing stages, which we're going to get through in the talk. And therefore, the important thing is basically your communication and your interpersonal relationship with the surgeon, because his work is basically done. He's already technically trained. The hard part now is getting two people on the same page. So this next slide that you're looking at is absolutely one of my heroes, which is Keith Richards. And it may seem very strange that I've got a slide of him, but I put this up to show several different points. The first point basically is more of a scientific point, and that is what happens to someone as their face ages. Basically, this is a perfect example of what you see as people get older, provided that there's no trauma done or there's no physical changes. And what you see here is loss of a lot of fat in the face, and most importantly, and what jumps out at the page mainly, is the fact that patients get wrinkling and laugh lines and frowns basically on common facial expressions that they make. And the idea that you hear that by the age of 40, you're responsible for your own face is really true. And what that means is that after somewhat 35 to 40 years of making the same facial expressions, your face eventually will naturally come back to those, and the skin will fold in such a way that if you always smile in a certain way, that's what you're going to see. And this slide, of course, is of his partner in crime, Mick Jagger, who, again, you can see the same kind of facial changes. Now, by the way, I think both of their faces look fantastic as they are now, and as much as I would, love to be a part of the Rolling Stones, I don't think that these two faces would benefit from plastic surgery at all. And I think that most people would probably agree that despite the wrinkly and the haggard look that they both have, it fits their faces and their frames perfectly. So the first thing that you need to do is work that you need to do before you get to the doctor's office, and that is you have to really take a look at your life and do some introspection. You have to make sure that you're not in an emotional state where plastic surgery would not be the best thing to do. And what that basically means is it's probably not the best thing to run right to the doctor's office after a breakup in a relationship, or to run right to the plastic surgeon's office after a loss in your life, like a death of a relative or of a good friend. And that kind of leads us also into the fact that nobody should really be influencing you to have plastic surgery, and the corollary to that is nobody should really be influencing you not to have plastic surgery. It's a very, very personal decision to make. In fact, it's so personal that I have husbands and wives who are patients of mine that I'm not able to tell the spouse that something's being done. Now, that's usually the exception rather than the rule, because it's always better to have spouses together and on the same page. However, that just gives you an idea of the privacy and the Hippocratic oath between doctor and patient, and how important that is, particularly in plastic surgery, that really is not violated in any sense. And that's why it's so important to do this really for yourself. So what's involved in a self-assessment? I tell patients basically to look at your features at night. Don't look at it in the morning, because when you wake up in the morning, everybody retains a little bit of fluid, and they look a little bit more swollen, and some of the lines that you normally see in the way you normally look throughout the course of the day is probably not too representative in the morning. Try and find one feature that you consider your best, and try and find one feature that you consider your worst. If you can't hone in on whether it's your eyes or whether it's your face, try and come up with just emotional questions. Do you look happy? Do you look sad? Do you look surprised all the time? Do people always tell you that you seem to look tired? The next thing you want to try and do is try and act a little bit the way an artist would, or a little bit the way a plastic surgeon would, and that is try to objectify little areas on your face. Try and figure out, is your nose particularly long? Is it particularly short? Do you think it's wide? Do you think your eyes are too far apart, or do you think they're too close? Now, you don't have to get very specific, but a lot of times when patients come in, and the first thing we do is we go to a mirror together and we look, I point out things that to me are very obvious, probably from years of training and looking at people, but somebody is usually not able to recognize very, very simple things on their own face. And they certainly, much more than I should be able to know what's important about their face. So I think that those things are very, very important. Try and quantify, do you have a long neck? Do you have a short neck? Do you kind of like the way you look?